Good morning everyone. We are going to discuss about the routes of drug administration. What is routes of drug administration? How the drug gets enter into the body by means of various way. There are two types of routes. The first one is localized administration. It's also known as an topical administration. And the second one is systemic administration. In topical administration, there are several routes. The first one is oral administration. Oral administration is the most oldest and common method of drug administration. It is the safest and most convenient method. This method is very painless, so that the medicament is need not to be sterilized, and the medicament is also available in the form of cheap. So oral administration means it's the oldest and cheapest mode of drug administration. It's the most convenient method. This method is very painless. The medicament is need not to be sterilized. The medicament is also available in the form of cheaper. For an example of this oral administration is capsules, tablets, syrups, mixtures which can be administered orally. If we administer an capsules or tablet or mixture, we will not feel any pain. So it is the most painless method for the administration of drug. Each method has several limitations, right? So the disadvantages of this oral route is action of drug is slower, and it is not applicable in case of emergency conditions. The oral route is not used in the case of emergency conditions. Some unpalatable drugs can be filled in the form of capsules, shell, or not to take in a or need to take any separate coatings in the form of any tablets. If the tablet or if the medicament is very unpleasant or unpalatable, we can't consume. It can be filled in the form of capsule, or we can manufacture in the form of tablet by giving some separate coatings. And the second type is sublingual or buccal route. So the tablet or pellet containing drug is placed under the tongue or crushed in mouth or spread through the buccal mucosa. Buccal mucosa is the inner lining of the mouth. So the tablet, a drug which contains a tablet or in the form of pellet which is placed is under the tongue, or which is crushed and placed under the mouth and spread through the buccal mucosa, where the drug gets enter into the body within a minute. So only lipid soluble drugs and non-irritating drugs can be administered, and absorption is rapid. The action can be produced within a minute. So what is sublingual method? Any medicament which is in the form of tablet or in the pellet which is placed under the tongue by means of crushing the powder, or some sublingual, some patches are available, so which is spread through the buccal mucosa. So only some lipid soluble drugs and non-irritating drugs can be administered in the sublingual route. The absorption is rapid. The action can be produced within a minute. The chief advantages is liver is bypassed. So the advantages of sublingual method of drug administration is the liver is bypassed. So the drug with higher first pass metabolism can be directly absorbed into the systemic circulation within a moment. For the example of sublingual route or buccal route, for an example is GTN, which is a glyceride trinitrate, can be administered in the sublingual route. So now we studied the oral route of drug administration and sublingual route of drug administration.